Thank you for joining us for this afternoon's Government of Newfoundland and Labrador's COVID-19 update for Monday, February 22nd, 2021. I'll now turn things over to Dr. Fitzgerald for an update on the latest numbers as we start a new week.
Thank you, Premier. Good afternoon, everyone. Thanks for joining us today. Since the media advisory yesterday, we've had 14 new confirmed cases of COVID-19 in our province. There are 4 under 20 years of age, 1 between 20 and 39, 2 between 40 and 49, 4 between 50 and 59, and 1 between 60 and 69. We have 2 travel-related cases, 1 in Labrador, Grenfell Health, in an individual between 50 and 59 years of age, and 1 in Western Health in an individual between 60 and 69 years of age. The total number of cases in our province is now 940. There have been 37 new recoveries in Eastern Health, leaving 407 active cases in the province. There are no new or outstanding presumptive cases. 5 people are in hospital with COVID-19. 1,037 people have been tested since yesterday for a total of 108,834 tested to date. We are beginning to see an encouraging trend with more recoveries than new cases, thereby reducing the number of active cases in the province. New cases and close contacts continue to be identified, and if you are contacted by public health, please be patient and follow their guidance. If you have been exposed, even as long as 3 weeks ago, you may be required to have a test and self-isolate until the results are back. Remember that this variant changes how we treat case contacts. It is essential that we leave no stone unturned in case finding. I am cautiously optimistic that we are making progress, but we are by no means out of the woods. We were fortunate to have detected this outbreak when we did, and we have to do everything we can to prevent another occurrence. That is why it is critical for everyone to stay vigilant. Please remember that alert level 5 is still in place across the province. This means that social gatherings outside of your household bubble should not be taking place. Keep your contacts to an absolute minimum. Maintain 6 feet distance from others and wear your mask when interacting with those outside your household bubble. Follow directional arrows in public spaces and on walking trails where indicated. Outdoor recreation activities are encouraged for anyone who is not self-isolating for any reason, whether it is through contact tracing or travel. But it must be limited to those in your household. If you are outdoors, you must still maintain at least 6 feet distance from others outside your household. If you have symptoms of COVID-19, use our online assessment and referral tool to book a COVID test. And please remember that symptoms can be mild. If your test is negative, stay home until 24 hours after your symptoms have passed. If your test is positive, you must self-isolate and you will be contacted by public health. COVID variants move faster and easier, which is why we refer to them as variants of concern. Just like the original COVID strain, variants will make their way into the province through travel, which is why self-isolation requirements are essential. All rotational workers, both Canadian and international, both from outbreak and non-outbreak sites, must fully self-isolate for 14 days. Modified self-isolation for Canadian rotational workers is not a safe option at this point. Rotational workers are not permitted to leave their property for 14 days. This means they cannot go for a walk or drive. They cannot interact with family unless their family is also self-isolating with the worker. All individuals traveling to our province have a responsibility to stay informed on the most current requirements. All travelers in self-isolation are contacted to ensure they are aware of and abiding by the requirements. And any traveler deemed to be willingly non-compliant will be referred to enforcement. And please note that if you are a traveler in self-isolation, our call may show up as an unknown number or on caller ID. If there is no response after several attempts by phone and email, this will also trigger a referral to enforcement. These measures are critical to protecting the health and well-being of our population. As a recap for those who may have just joined us, we have 14 new confirmed cases since yesterday's media advisory, and the total number of cases in the province is now 940. Our ability to see this through will depend on our continued patience and dedication as we all do our part to keep each other safe. So hold fast, Newfoundland and Labrador. Thank you.
Well, thank you, Dr. Fitzgerald. This is, of course, day 10 of our heightened alert status. And though we have seen an expected fluctuation in our COVID-19 numbers, the lockdown measures are doing what they should. Broad testing is working. Containment is working. Your efforts to stay at home and to reduce your contacts and follow public health measures are working. Yes, we have a way to go, but abiding by the stringent rules laid out by Dr. Fitzgerald and her team will allow us to fight our way back out of lockdown. I want to introduce some balance here, too. A reminder that the dark days of lockdown have revealed some truly bright moments in Newfoundland and Labrador. For example, I've heard several stories of amazing teachers who've been really connecting with their students online, building new ways to learn and keeping their morale up despite the challenges. Teachers have really stepped up during this lockdown. I've heard of workers in long-term care cheerleading each other's teams, propping up those who have been on the front line, never letting their commitment wane. The many photos that we've all seen and stories from nurses working late into the night to ensure that we are getting the testing that we need. And then there's the outpouring of support for truckers, the lifeline of our province. From Port aux Basques to Gander, businesses and groups such as the Salvation Army have been providing food, beverages, and the facilities to keep them safe. Look to your own social media feeds to find those positive stories happening around us every day. Neighbors preparing extras at supper time and offering them out on social media to whomever need it, or whoever needs a little break. Social media communities built around creating amazing backyard rinks to keep our kids active, safe, and outdoors. We must look for more of these moments. That's what we need to see. That's what we need to share. Kindness, my friends, is more than a kind word. Throughout our province's history, we've seen examples of Newfoundlanders and Labradorians stepping up, taking in, and giving back. We need to write our own chapter in that story by what we can do here, today. One kind act, added to a few, added to many. Ask yourself, ask your family, ask your neighbors and friends, what will your kindness be? And let's please let kindness be the only thing that spreads. With that, I'll turn it over to Dr. Haggie for some brief comments.
Thank you very much, Premier, indeed. Day 351, but as you say, day 10 of the new lockdown, level 5. I think we are optimistic, cautiously, that we may see a crossover day here when our new cases are lower in number than our actual recoveries. I think, though, rather than celebrate just yet, we need to realize that what has happened today is actually reflective of the actions that we took 10 days ago collectively to bring this variant under the control that we could. And similarly, what will happen over the next 10 to 14 days very much depends on what we did yesterday at the weekend, what we do today, and what we will do tomorrow. This is a time to persevere with what we know has worked in the past and is working again now. Those tried and tested public health measures that Dr. Fitzgerald has repeatedly mentioned and that public health are reinforcing on a daily basis. In terms of the healthcare system at large, I think it's important to emphasize that medical care provided either by nurse practitioners, primary care physicians, or specialists is still available and is still going on. Certainly within the hospitals, emergency care and cancer care continues. But if you need the services of a physician, then the thing to do is to contact their office. They may agree with you that an in-person visit is essential, in which case they more than likely will screen that beforehand with a virtual conversation. But if you are in need, then you must reach out. These individuals are available and care is still there. One of the things that we are really waiting on continues to be the ramp-up of vaccine delivery. We will get our supply in the next 24 to 36 hours for this week. We've seen a continued rollout of what we have had for seniors in congregate living and at-risk potential high exposure healthcare workers. As the vaccine becomes more available, we will work our way through the other criteria through essential healthcare workers and essential workers, as well as seniors in the community and these kind of things. We have arrangements for those, but quite frankly, absent a vaccine that's reliable in numbers, it is premature to raise people's expectations with dates that we only know at the moment are likely to be missed because of vaccine supply that is outside our control. And we continue to work with our partners to see what we can do to shore up that vaccine supply and to make sure that the shortcomings of the last little while from the manufacturers are not only made up but exceeded as they have promised. We will try our very best to hold them to their word. The important thing, as the Premier and Dr. Fitzgerald have said, is that, movement and unnecessary interaction spreads this virus. No one should be moving around the province for anything other than essential reasons, for supplies that you can't manage without, for healthcare, and for these kind of family emergencies that we have heard about all too frequently. There should be no non-essential travel at all. And with that gives us the opportunity to simply spread kindness and not the virus. And I think with that, Premier, I'll hand it back to yourself for the rest of the event.
Well, thank you, Minister Haggie. We'll now open it up to questions from the media.
Thank you, Premier. For the benefit of our speakers, there are 7 reporters registered for today's call. The question and answer session will be conducted in 2 rounds, where each reporter will have the opportunity to ask 1 question and 1 follow-up per round. Following this, I will ask each reporter if they have 1 final question. Our first questions are from Peter Cowan with CBC. Please go ahead.
Dr. Fitzgerald or Minister Haggie, not sure who's best to take this. We've heard that there's a positive case of a resident in a personal care home in Kelligrews. Can you provide us with an update on what the situation is there and how public health is responding?
Peter, I'm not aware of a resident in a personal care home being tested positive. I'm sorry.
Okay. And question about vaccinations. We're seeing people over 75 getting vaccinated on the south coast of Labrador, for example. Why are they farther ahead? And when can we expect that other people of that age range in other parts of the province will be able to get vaccinated?
Minister Haggie, do you want to take that? Or?
I can do, Premier, certainly. The isolated communities that are fly-in or who have limited capacities in terms of healthcare services and clinics were always prioritized. And because of the way the Moderna has rolled out, there was an opportunity while visiting those communities to engage those eligible individuals in the seniors age group who wanted to access it. This was that combination, that crossover between isolated and remote communities and the older groups. On the island, we have different logistics and different challenges. Our plan in terms of the vaccine rollout, when numbers allow, is to move away from those in congregate living, by which we mean long-term care or personal care homes, and then work our way down the age spectrum in the community. If we had the vaccine in numbers, we would actually simply start with a mass vaccination campaign through those groups. But we simply cannot give what we do not have. So we have to give it to those at greatest risk as the numbers allow with deliveries.
Thanks.
Our next questions are from Peter Jackson with The Telegram. Please go ahead.
I think you're on mute there, Peter.
Sorry, I'd like to continue that line of questioning about vaccines. We've had, I should think, about 2 months to identify approximately how many people would qualify under the frontline healthcare and congregate living categories, which means that we should have some idea of how many people are left in those communities? Why is it we can't get some sort of indication as to when the next round, or even how many vaccines away we are from the next round?
Certainly, Peter, I'll have a stab at that. The essence really is simply down to vaccine supply. We have 9,200 individuals in the healthcare system that we have identified as essential. Within that, there are subgroups of people who would be somewhat more at risk, those working on COVID units or intensive care and emergency, for example. In terms of congregate living, we know we have around 4,000 seniors in long-term care and a slightly lower number in personal care homes. The challenge is that our vaccine delivery has not yet matched even those numbers, so we are working through those. As of this week, our latest intelligence is that we should receive 6 trays of Pfizer this week, which will then feed into those high-risk groups. Once they are complete, it is the aim of public health, guided by NACI and the vaccine team, to roll vaccines out into seniors in the community across the province. That will have to be done in a stratified way as well, and we have those numbers. How many people are over 90? How many people are over 80? And quite frankly, with the vaccine supply as it currently stands, we will have to take them 10-year, 5-year groups at a time. They get increasingly larger as we get younger down to 65.
Okay, thank you. The town of Happy Valley has formally requested point of entry testing be conducted on anyone entering Labrador. Is this something the government would consider implementing?
We're scheduled to have a working group style meeting with leaders from Labrador tomorrow, Dr. Fitzgerald and her team, to discuss nuances of the Labrador border and entry into Labrador.
Okay. Thank you.
Our next questions are from Kellyanne Roberts with NTV. Please go ahead.
Thank you. I'm also going to continue the line of questioning with when it comes to the vaccine. Previously, last week, Minister, you had said that we were doing approximately 84% administration of vaccine received when it comes to Pfizer. Are we utilizing all the resources possible to increase that number? I'm talking pharmacists, nursing students, anyone who potentially could administer this vaccine. Are we utilizing that?
We would if we had the need to. Unfortunately, the challenge has been we got 5 trays of Pfizer for the first time last Wednesday. We have no challenges within our public health system from administering the doses that we are receiving. If we are ever fortunate enough to get into the situation of having more doses to give than we have public health staff to give them, we have a whole series of planned options to engage other practitioners whose scope of practice allows them to provide vaccination. Our problem is we don't have the vaccine.
And I understand that. I'm just saying that in terms of what we do have. But in going forward on that, Halifax today is going to begin general public vaccination with those 80 and above. They've sent out mail kits to those to inform them on how to book an appointment. Is the province looking to do something similar for those over the age of 85 as they are listed in the Priority 1 group?
Short answer is yes. Sorry, did I interrupt somebody?
We were all saying yes, yeah. So you go ahead, Minister.
No, I mean, there are arrangements to do that. I think one of our challenges is that machine is poised to be triggered. But if we go out tomorrow and say, here's how you schedule your vaccination, and we don't have the vaccine for another 3 or 4 weeks, the challenge there is around people saying, well, you've forgotten about me. And I think really and honestly, it's unfair to raise those expectations until we know for sure. And by and large, we get about 2 weeks' notice of guarantee of vaccine supply. So I think that's the kind of notice that we're going to have when we move from one tranche of high risk or nasty category before we can move to the other. As the summer comes and spring leaves us, we should be in a different situation, because my understanding is at that point, both Pfizer and Moderna will have ramped up their production beyond expected levels. In addition to that, there is talk of AstraZeneca, there's talk of Johnson & Johnson, and there's talk of Novavax making an appearance. Under those circumstances, we hope to be in a situation where we have the vaccine to give. We've shown very clearly from our flu campaign that we can vaccinate 80,000 people a month, even in a pandemic. We just do not have the vaccine to give them.
Thank you.
Our next questions are from Jason Piercy with Rogers Communications. Please go ahead.
Hi, it appears as though vaccine talk is really popular today. Minister Haggie, with respect to the importance of proper and improper storage, either during delivery and after acceptance, could you please, if you don't mind, give us an update on the viability of all of our recent deliveries of vaccines?
In terms of the technical specifications, Dr. Fitzgerald would probably be better to answer some of those questions. I do know Pfizer have relaxed some of their requirements in terms of temperature versus viability, so they can be shipped in simply a low freezer rather than ultra low immediately in the month, for example, prior to administration. We are not aware, and I have asked, of any vaccine currently having been delivered to the province that has been lost because of transportation issues.
Okay, so you are in a position to rectify a rumor that a shipment was lost due to storage issues?
We have had no losses that I've been notified of. There was some concern at one stage about one shipment in Central, right back at the beginning, with the move into Grand Falls, Windsor, but that turned out to be an error on part of the temperature monitor within the cold shipper.
Absolutely fantastic news. Thank you, Minister.
Our next questions are from Brian Callahan with VOCM. Please go ahead.
Thank you. Dr. Haggie, you just mentioned the Pfizer vaccine and the relaxed nature, you used the words, of the ultra-cold temperatures. It looks like science says now that it doesn't need to be stored at the ultra-cold, which could probably make it more readily available here, but when you get it. So but the one thing that came out with that science as well is that one dose may now be 85 to 90% effective, and that they're finding out that the second dose is not insignificant, but a pittance compared to the importance of the first. So could you possibly spread out the vaccine supply in the province? And as you said, it's not available, but it seems you could probably double the amount of people who get it the first time.
I think that question would be better addressed to Dr. Fitzgerald or a virologist. I can't speak to the science behind one dose versus two with any confidence. That's what we have our public health and immunization experts for. Sorry.
Dr. Fitzgerald did speak to that similar question the other day. Do you want to go ahead, Dr. Fitzgerald?
Sure. So certainly, we know that what Pfizer has given us is instructions for how to transport this vaccine without having to transport it in the ultra-low frozen state. We still can be stored in, and then we have to use it within 5 days. So it's it's still a bit. We have to know that we need to use it before we send it out, So it does, logistically, it is still challenging. So we can't store it for an extended period of time after it's been thawed. And then with Moderna, it's 30 days that we can keep it in the fridge. So we still have to remember those. With regard to the extended dose intervals, certainly those studies have been done, and I'm sure that NACI, the National Advisory Committee on Immunization, is reviewing those as we speak. But, with regard to making decisions about whether you can delay a second dose, that would require a fairly in-depth study of more than just one scientific article. We would have to do some deeper research into that before we would make that recommendation.
Okay, my understanding was that was from Pfizer, but understood. Nurses, of course, would be, the frontline workers. Their president told us today, told the OCM's Linda Swain, that 70% of nurses have yet to be vaccinated. I'm wondering if that's accurate and if that's a target, if that's enough, I guess.
I couldn't speak to the figure of healthcare workers that have yet had their vaccination. We can go back and get that, both broken down by one and second dose, too. I don't have that figure to hand, so I couldn't give you a percentage.
Thank you.
Our next questions are from Elizabeth Witten with All Newfoundland and Labrador. Please go ahead.
Thank you. I'm looking for an update on the status of the whole genome sequencing lab. It was meant to be up and running late last week, so I'm wondering what's its status?
No, so unfortunately there was some delays in that. We're hoping to have it by the end of the month, but at the moment, no, it's not it's not up and running.
All right. And as a follow-up, can I get a bit more detail on what exactly kind of delayed that?
I wouldn't be able to answer that question. Unfortunately, I'm not 100% sure, so I wouldn't want to speak out of turn.
Minister, do you want to weigh in on that?
No, I think that's a question better addressed to the laboratory director of public health, maybe, or there. I can certainly go back and ask the question, but I'm as knowledgeable about this as Dr. Fitzgerald.
We'll certainly endeavor to find the information for you, though.
Perfect.
Our next questions are from Roger Bill with the Shoreline News. Please go ahead.
Dr. Fitzgerald, in your opening remarks, you said we were seeing an encouraging trend, and you said you were cautiously optimistic that we're making progress. I want to ask you about something Dr. Theresa Tam, the Chief Public Health Officer, is quoted as saying by Canadian Press this morning, and that is, she says, our collective effort has begun to tip the balance in our favor. Have we reached the point now in Newfoundland that we can say that the balance has tipped in our favor?
No, I don't think I would say that just yet. I think we need to have a little bit more time. I mean, Dr. Tam is talking about the situation across Canada, and certainly across Canada we have seen reduced every week, a reduced number of cases being reported. So that's been a trend over the last several weeks. I don't think we're at that same point here. We're still, having to watch things carefully, but, we're hopeful that we acted on this as quickly as possible and we're able to get things to reduce the spread of this variant as much as possible. But I think we will still see cases, and we may see days that there are a few more cases than 14. It just depends on secondary and third generation spread. So we'll have to see how the next week to two goes.
Thank you. Dr. Haggie, you said we're getting 5 trays of the Pfizer vaccine at 975 doses a tray. That's less than 5,000 doses. And if we're using 2 doses per person, that means we're covering 2,500 people. And it seems to me that another observation that Dr. Tam made might be accurate. She's quoted on CBC.ca this morning as saying, for the next few months, we're not going to have a lot of people vaccinated. That's just a fact. You concur?
I think that the math is slightly different, actually, and I may have misspoken. We certainly had 5 trays last week. My understanding was originally we were scheduled for 5 but I was told as recently as this morning that it would actually be 6. There are 175 vials in a tray, and Pfizer now say that with a low volume or low dead space syringe, you could actually get 6 doses out of each vial. So that would theoretically bump the total up per tray to just over 1,000. The detail is different, but the principle is the same. Our challenge is that we have an extremely good public health mechanism across the province, which has proven itself time and time again capable of administering significant doses of vaccine in a very short period of time to a large number of people. We simply do not have the material to give out. And until, by Pfizer's explanations anyway, until March rolls around at the very early, they don't see even making up the deficit from what they should have supplied us, let alone making good on their promise of January to increase that by possibly as many as 250,000 doses. So, I wait each week to see what the guaranteed tray number is for the next week.
Thank you.
Our next questions are from Peter Cowan with CBC. Please go ahead.
I want to ask about vaccinations for frontline workers. We're hearing from folks that work in the COVID unit who still haven't been scheduled for a vaccine, and they say that they're not alone. So why are we still seeing some of those key people not being vaccinated yet?
I think that's more of an operational issue, Peter. Quite frankly, not everybody stepped up first time round, and my understanding of the uptake was it did vary. It was pretty good amongst healthcare workers, but quite frankly, I've never yet seen a vaccine campaign that's got to 100% of eligible people. I can certainly go back in line with this question and with some others to find out just how many healthcare workers in what categories have been vaccinated. But a healthcare worker is not a healthcare worker in the sense of them all being a homogenous group. There are some that are at significantly elevated risk compared with others. And so we've tried to focus on that group first. And we have relied on the RHAs and directors and VPs to advise us of who those individuals would be, and then to canvass them to see if they would be interested, because we have not, and I don't think there's any appetite to mandate vaccinations.
And Dr. Fitzgerald, in the past you've said it's not just the number of cases, it's the epidemiology that's important to you. So can you give us an idea, now that we are 10 days into this lockdown, who are the people who are testing positive? Are these people already in isolation? Are we continuing to see the virus spread? What's happening right now?
So at the moment, certainly, I think a lot of people were in isolation. A lot were contacts of cases that were identified, and a lot obviously in the beginning were young people at the high schools and their close contacts. So now we're seeing a slight skew in to an older age group, and our average age has gone up. Sorry, I put my glasses on here. Our average age has gone up to 32 years, and I think earlier on it was down around 20. So, and the median age is about 25 years. So we are seeing a slight increase in the 40 to 59 year age group, as well as the 20 to 39 year age group. So we're, that's what we're seeing now. We've also seen a few people who were asymptomatic throughout their isolation who tested positive at the end of their of that isolation period in the last couple of days when we asked some of those students to get retested. So we did see some positives pop up there again.
Okay, thanks.
Our next questions are from Peter Jackson with The Telegram. Please go ahead.
You may have actually answered my question 2 seconds ago. I'm wondering what the rationale was for retesting students at Mount Pearl Senior High. Can you explain what's happening there again?
Sure. So what we found in the beginning when we looked at a lot of these students who tested positive and, school age, there was over 221 people in that 5 to 18 year range. And what we found with a lot of them was that they had very mild symptoms or no symptoms at all, but they were able to still spread it even with no symptoms, which we know that is a possibility with this virus regardless, but it certainly seemed to be a significant player here. And so our concern was that some of these students who initially tested negative would then go on to develop disease or develop COVID and be able to spread it without developing a whole lot of symptoms or any symptoms at all. And so we wanted to just make sure where we had so many coming out of isolation at the same time, and where they had that potential to pass on disease without really knowing that they were sick with it, we wanted to test and see if anybody was asymptomatic and positive. So, and we did find a few. I don't know the number right off the top of my head, but we did find some.
Interesting. Given the spread of the virus now in the province, something we've never had before now, would you consider there to be any benefit of a sewage testing in an effort to catch prevalence of the virus in areas where testing hasn't caught it?
I'm sorry, Peter.
Yeah, you broke up
I
there,
really couldn't hear what you were saying.
The testing of sewage, wastewater, do you consider that to be something that would be useful now?
Yeah, and in fact, we have started that. So it's starting here in the metro region, and we are looking into how we would be able to use that elsewhere in the province. It's not quite as simple as just going in and testing the wastewater. There is a protocol and a process that has to happen, and that's not always feasible in some areas, depending on the type of system that you have. I don't know all the details of it, not an engineer by any stretch, but so there are some considerations. So for right now, we're starting some initial investigations and exploration into that, and but it's still very early days, and of course now where we're having an outbreak, we would expect to see higher levels. So it really will be most useful as time goes on, and once we come down from this and we see if it picks up signals in the future, really. At this point, right now, it's probably not as useful, but we do need to kind of get a baseline and see how things are going to go over the next little while.
Thank you.
Our next questions are from Kellyanne Roberts with NTV. Please go ahead.
Thank you. Minister, in your opening remarks, you noted that the next phase, or those in the next phase, won't likely know till we're closer to. And Peter Jackson has asked a similar question to what I'm asking now, in that we've had 2 months to kind of figure out who might be listed in that. I'm wondering if we've had a closer look at some of the first responders for that. Again, knowing that we're not near phase 2 yet, but a lot of these people are very worried about where they land on the list. And I'm referring to first responders in regards to firefighters, as we've seen a lot of them being self-isolating right now, which does impact that vital service.
Yeah, sure. I mean, I've had representations either directly or through the department from particularly St. John's Regional Fire Department. Some of their paramedics have already been vaccinated. These are essential workers, and they would fall into that category intermediate between the highest risk, but, you know, obviously in a higher risk category than some of the other healthcare workers that we have. And unfortunately, because of the kind of rationing approach that we've had to adopt with vaccination, they kind of fit in the middle. Again, until we kind of see the whites of the eyes of these vaccine trades, it's really very difficult for me to give any kind of firm commitment, because if I did it today in the hopes of settling down and reassuring people, the only thing I could guarantee is the date I gave you would be wrong.
Fair enough. I also want to touch on the point of entry testing and in regards to rapid testing, because we had heard several months ago that we weren't going to rely on it at our borders because of the rate for false negatives and false positives. But here we are using it now in terms of we need to find out information quickly. And of course, again, understanding that we're testing it against the PCR test and everything. So are we not having another look at maybe implementing this at our borders as that extra precaution, especially as variants wrap up across the country?
So, you know, with point of entry testing, with rapid testing, we right now are using it to help us find cases in a situation where we know that a person's probability of having disease prior to doing the test is actually a little bit higher than, the general population because of the situation that we were in. So we are, you have to consider that. That's a big consideration because that influences how many false positives you will get. It also can have an impact on your false negatives. But so we do need to make sure that when we're doing these types of tests that we're actually using the proper tests to give us the information that we need. Right now I'm not sure that rapid testing at points of entry is going to give us that information that we need. These are all things that we are exploring right now. Obviously, as I've said before, the variants are a game changer, and the way that they spread certainly does have implications with regard to quarantine and things like that. So, these are all questions we're looking at right now. I think they're questions everyone is looking at right now. And so once we once we kind of explore all the options and the evidence, then we will make some recommendations about that.
Thank you.
Our next questions are from Jason Piercy with Rogers Communications. Please go ahead.
Hello, thank you. We're breaking down our caseload by age, sex, which location they're in, and I can, in my head, intuitively, it makes a great deal when it comes to age. It makes a great deal of sense to categorize things in gaps of 20 years once you hit 40 and over, and maybe even 20 to 40. But there's something in me that says there might be significance to understanding whether somebody is, when we're a youth, if they're a child, the breakdown between, say, ages 0 and 5, or 5 to 10, or 10 to 15, or 15 to 20. I'm just wondering if there's any particular medical reason or privacy reason why those aren't things that we are monitoring.
So I think we are monitoring the ages of people who get this disease, but the reporting has to do with the way that we report across the country, really, and trying to maintain consistency there. But those are things, just because it's, we may not break it down all the way, we are looking at all of that information from an epidemiological point of view.
So would it be possible to tell us how many people under 10 are positive in the province right now?
It would be possible. I don't have that information, though, at the moment.
Okay, I understand. Thank you very much.
Our next questions are from Brian Callahan with VOCM. Please go ahead.
Hi, just following up on an earlier question. Do you have a running priority list right now, like a working or a draft list, like other provinces do?
For
whoever's priorities for vaccine.
Oh, yes, we certainly are working on those priorities, and I think we're very close. It's just we want to make sure that what we're doing rings true, and that we have a thoughtful discussion about who should be where. And it's not an easy discussion. It's not easy decisions that have to be made. So. There is some consultation that has to happen too. So we are working through some drafts now.
Okay. Any idea when the public might know what that looks like? Because we are, again, getting, as you can appreciate, so many calls and so many questions. A lot of them have to do with who's next, and who's going to get it first. So can you give the public an idea when they might know who is on and the priority list and where they stand?
So right now we are working through things. I hope that we will have it fairly soon. I don't want to give you a date, though, honestly, because then we'll be back here asking the same question. So we hope to have it very soon.
The vaccine team, though, Brian, is working very hard to ensure that all evidence is being weighed, and we know that people are stuck in between levels and everything else, and we want to make sure that we get this right. That's most important. And they are working extremely hard to ensure that Phase 2 is well-defined and rolled out at the appropriate time when vaccine supply, of course, as Minister Haggie has said over and over again, becomes more robust.
Thank you. I think that's my one, is it?
That's your two. Yep. You'll have a chance for one more in the next round, Brian.
Yeah, no worries.
Our next questions are from Elizabeth Witten with All Newfoundland Labrador. Please go ahead.
Thank you. Just to follow up on my earlier questions, with this ongoing variant outbreak, which has been called, a game changer a number of times, I'm wondering, the news of the whole genome sequencing lab has been delayed. Is this a cause of concern for you, all three of you? And, what is the priority of getting whole genome sequencing available here rather than sending it off to the National Microbiology Lab?
What we have to remember right now is that, generally speaking, that any of the cases that we see in the metro area that are not, don't have an obvious source or that are contacts of a case, we know that they're B117, and that's the assumption we go on. So we don't need to test every sample that comes through that tests positive. We do still have our criteria for who we send off to the lab in Winnipeg, and we are still following that. So, we are testing those from international travelers. We're testing those related to healthcare workers. We're testing others that may seem, there may be a suspicious transmission pattern or something like that. These are all samples that we would send off for testing. So that's still happening. And we can, if we are really suspicious and we're concerned, we can have a test back in about 72 hours.
I think it's just worth highlighting that, again, we're presuming that almost always that this is the variant and treating it as such. And then if you take that presumption, then the most logical next step is to make sure that we're getting the most number of tests done. And we know that the variant picks up on PCR and rapid tests like the other normal COVID variants. So those tests would take priority over the full genome sequencing at this particular moment in the pandemic and given the epidemiology.
Thank you. And with the spike in cases, I'd like to know what the current PPE burn rate is. And out of what we have, I'm curious, how much is locally sourced?
Minister, that's a question.
From the point of view of burn rate, it has increased over the last week for sure. We tend to use a 2-week rolling average to try and calculate burn rate. We have a significant order of gloves, for example, extra large gloves coming in tomorrow, because that was identified last week as a source of potential challenge. It's very difficult when we break it down by individual sizes to give a meaningful figure. But the range in terms of burn rate currently for the commonly used items such as gowns and those kind of things is between 25 and 70 days at the burn rate we had last week. Some things on the end, face shields, we'd probably not run out of them for the next 200 years at this rate. But there are some items like the gloves. As of yesterday, we were in short supply. Today, we're good.
Thank you.
Our next questions are from Roger Bill with the Shoreline News. Please go ahead.
Premier Furey, last Friday I asked you about the Manitoba plan to contract on their own, apart from the federal government plan, to contract on their own for vaccines. And I asked you if you'd had a conversation with Manitoba Premier Ballister about it. You said no, but you also went on to say you had a high-level conversation with Premier Ford in Ontario. So I'd like to ask my two questions all in one gulp here. Was that a recent conversation? Was it one-on-one? Was it just a conversation where in general he wanted to solicit support for an idea of having manufacturing of vaccines done here in Canada? Or was there a particular Newfoundland angle?
No, it was a phone conversation between myself and Premier Ford, discussing the situation in our province, and it was last. Forgive me, Roger, if I get the days off by one or two, but I believe it was last Thursday evening we spoke. We talked about looking into the future about ensuring that Canada as a country doesn't find itself in this situation again, where important medical supplies like pharmaceuticals and vaccines are not being manufactured in Canada. And he says his province is looking at securing a manufacturing agenda or strategy for Ontario, and that's certainly something that from Newfoundland and Labrador's perspective we'd be supportive of. That was the high level conversation. We did kind of discuss, of course, the new variant and the impacts it's had on both our provinces, but that was about the extent of the conversation.
Thank you.
I will now go back through each reporter to see if you have one final question. Peter Cowan with CBC. Do you have a final question?
I do, and that's about mask wearing. I noticed that at previous briefings, people in the media center haven't worn masks, and today you've been wearing them for some parts of the briefing. Wondering if you could just explain what changed.
Well, we just recommended that everybody should be wearing masks outside of their household bubble, so I think we just need to set the example and just to say that it wasn't everybody in the media room who wasn't wearing masks. It was just us. So we just felt that we needed to wear them as well.
Jackson with the Telegram, do you have a final question?
I'm not actually watching the video, so I didn't realize you were wearing masks. I would like to know if you are concerned about further hospitalizations, since that statistic tends to lag the actual positive numbers.
I think we're always concerned about hospitalizations, Peter, and you're right, it does lag behind the numbers, and that's something that we're following closely. Dr. Fitzgerald and her team are following closely. We're all tracking that as a significant variable and parameter moving forward to ensure that we're prepared for if there is an increase in hospitalizations.
Okay, thank you.
Kellyanne Roberts with NTV, do you have a final question?
Is there anyone in the ICU due to COVID-19 right now?
Yes, there are hospitalizations in the ICU.
Due to COVID-19?
Yes.
Okay, thank you.
Jason Piercy with Rogers Communications, do you have a final question?
Yes, I do. Thank you. We're all aware that people have to travel in and out of our province for work, and a lot has been said about rotational workers and how difficult that is for them. And I think there's a lot of sympathy there, but not much has been said about people who qualify as exempt workers. I'm wondering if you could briefly explain the concept of an exempt worker and perhaps give us an idea of how we're monitoring their activities and keeping them accountable.
So an exempt worker would be someone who's an essential worker, who has come into the province, who's deemed to be essential by the employer, and they have to, they do have to follow certain rules while they're at work. They have to physically distance as much as they can within the parameters of their job. They also have to wear a mask as per the mask rules, and they can't, they have to try to distance from their coworkers as much as possible, when not actually performing their duties, so on breaks and things like that. And then after hours, they are required to isolate the same as anybody else would be. So they are only allowed to come out of isolation to do their essential work.
Just as a quick follow-up, in the contract,
No, it's
contact.
just one final question,
All right.
Jason.
Thank
Sorry.
you.
No problem. Brian Callahan with VOCM, do you have a final question?
Yes, thanks. We all know what COVID-19 can do to our physical health, and, the symptoms are visible, but it's widely believed, that it's taking likely an even greater toll on everyone's mental health, and everyone, not just people who are infected or whatever. But so, is it time to add a member to your panel? Maybe subtract one? Add one, an expert maybe on mental health, or seniors advocate, the children's advocate, child psychologist, maybe even Dr. Tam, as referenced earlier, for the wider national perspective?
Certainly, we all appreciate the toll that this is taking on people's mental health. You're absolutely right. And we have put together some supports, as mentioned in previous briefings, like Bridge the Gap and helplines, and we're encouraging everybody to take their own mental health very seriously. And these are stressful times, and try to, reach out if you need help, of course. And if you know someone who is struggling, reach out to them virtually and safely. The mental health issues are going to be ones that we're all going to struggle with as we navigate our way through this complex situation. And as we come together as a society and help and lean on each other, then that's going to be one of the best ways to get through. But there are supports out there for people who need them, and we encourage anyone who needs help to reach out.
Sorry, is that a no?
Well, I mean, your question was about adding multiple different people, but some...
Not multiple, but maybe possibly one and switch them out, for various people's issues,
We can certainly have a specific media veil around mental health and addictions. Certainly, it's something that I've recognized in my previous life is important, and now it's heightened with respect to this pandemic. Absolutely.
Thank you.
Elizabeth Whitten with All Newfoundland and Labrador, do you have a final question?
Yes, I do. I want to follow up on a question Kellyanne asked. We now know that there are some people in the ICU due to COVID, so there are 5 people currently hospitalized. So I'm wondering how many of those are in the ICU?
So I don't think I can go any further than that, just because of the small numbers, except to say that there are some ICU admissions.
Okay, not as a follow-up question, but I remember back in like March, the very onset of the pandemic, we were getting those numbers.
Mm-hmm. You were. And
all right, thank you.
Roger Bill with the Shoreline News. Do you have a final question?
No, I don't. Thanks very much.
Take you, everyone. Premier, do you have any final comments today?
Thanks, everybody, for joining. I'm encouraging everybody to, again, take note of your own mental health and please reach out if you need any help or if you know of anyone who's suffering through this. You don't have to suffer alone. There are supports available to you. But overall, please take this moment and recognize that the measures, although it's still a long path ahead, the measures are working. And that's because of everything that you're doing. You're digging deep. You're following the public health guidelines. You're securing your isolation. That's allowed this disease not to spread further than it already has and has allowed for some early levels of containment. And that, a thank you on behalf of the panel to each and every one of you for the sacrifices that you've made in doing your part to help control the spread of COVID-19. So thank you very much.
Thank you, Premier. Stay safe, everyone. Take care of yourselves and each other, and enjoy the rest of your day.